Congenital cytomegalovirus (CMV) infection occurs when a baby is born infected with the virus as a result of maternal transmission during pregnancy. Newborns may exhibit symptoms such as jaundice, a purplish skin rash, or a low birth weight, and in more severe cases, the infection can lead to hearing loss, developmental delays, and microcephaly. However, it's important to note that not all infected infants show signs of the disease at birth. Some may develop symptoms over time, which can include hearing or vision loss, intellectual disabilities, and coordination problems. Treatment for congenital CMV can include antiviral medications to help limit the virus's effects, but managing long-term health issues is often a coordinated effort involving medication, physical therapy, and educational interventions. Pregnant women with weaker immune systems, those with frequent exposure to young children, or who have received an organ transplant are at a higher risk for transmitting MV to their unborn child. Here's a deeper look into the intricate aspects of congenital CMV infection, its implications, and the ongoing efforts to prevent and manage its impact. Symptoms and progression of congenital CMV infection. Congenital CMV, cytomegalovirus infection, which occurs when a baby is infected with the virus in utero, presents a spectrum of symptoms that range from mild to severe, with the potential for long-term health complications. Most newborns with the infection are asymptomatic at birth, yet some display telltale signs such as jaundice, petechiae, microcephaly, and hepatosplenomegaly. As the child develops, hearing loss, vision impairment, and intellectual disabilities may manifest. The progression is unpredictable. Some children experience deterioration in hearing or cognitive abilities over time, while others may have stable symptoms or even some degree of improvement with early intervention and supportive therapies. Diagnosis of congenital CMV infection. Diagnosis of congenital CMV, cytomegalovirus infection, is a critical step in preventing long-term sequelae in newborns. Due to the virus's capacity for causing various developmental delays and disabilities, such as hearing loss, vision impairment, and cognitive deficits, early detection can be life-altering. The gold standard for diagnosis is testing the infant's saliva or urine for CMV DNA within the first 2 to 3 weeks of life, ensuring the virus was present at birth and not acquired postnatally. Polymerase chain reaction (PCR) tests are commonly used for their high sensitivity and specificity. Interventions, including antiviral treatments and supportive therapies, can commence immediately after diagnosis, enhancing the newborn's quality of life and developmental outcomes. Public health strategies now often include screening programs for CMV to institute timely therapeutic measures. Cause and risk factor of congenital CMV infection. Congenital cytomegalovirus (CMV) infection occurs when a mother transmits the virus to the fetus during pregnancy. CMV is a common virus in the herpes family, and while it generally causes mild effects in healthy individuals, the implications can be severe for unborn babies. The major risk factor for transmission is primary maternal CMV infection during pregnancy, especially if it occurs in the first trimester when the fetus is most vulnerable to developmental disruptions. Secondary maternal infection, or reactivation of the virus in a previously infected individual, can also pose a risk, albeit lower. Further, mothers with weakened immune systems, or those working in childcare settings, where the virus commonly circulates among young children, are at increased risk of contracting and passing the virus to their unborn child. Neonatal consequences range from hearing loss to more significant neurodevelopmental disorders, underlining the importance of prevention and early detection. Treatment and management of congenital CMV infection. Treatment and management of congenital cytomegalovirus (CMV) infection primarily focuses on preventing and reducing the severity of symptoms and long-term disabilities. Antiviral medications like ganciclovir and its oral prodrug valganciclovir have been employed to treat symptomatic newborns, improving hearing outcomes and developmental milestones. Early intervention services play a crucial role in supporting affected infants, offering therapies such as physical, occupational, and speech therapy to bolster development. Additionally, regular hearing and vision assessments are vital because congenital CMV can lead to progressive hearing loss and vision impairment. It's important for affected children to have a multidisciplinary team, including infectious disease specialists, audiologists, and neurologists, for comprehensive care and to ensure ongoing monitoring and appropriate treatments as the child grows.